I feel like my anxiety for me feels like I'm always overwhelmed by nothing. And when there is something to be overwhelmed about, it's all consuming.
Hi, I'm Dr. Jessica Yu. I'm a licensed clinical psychologist and senior director of patient experience at Hims & Hers. Anxiety disorders are a group of mental health disorders characterized by persistent worry, anxiety, and fear. They're the most common of the mental health disorders. Approximately 20% of the US adult population deals with an anxiety disorder in any given year. We all experience anxiety sometimes. It's not uncommon to feel nervous during certain types of stressful situations, like a job interview, for example. Anxiety can even be productive. It can energize us. It can fuel us to plan and prepare for things. When anxiety becomes persistent or excessive, when it starts to interfere with our lives, when it starts to make it hard for us to do work or go to school or go about our daily tasks or engage in relationships, that's when we suspect something like an anxiety disorder.
It got to a point where it was all encompassing, honestly. And like, I couldn't do things without like my anxiety like overtaking me. I didn't really know what it was, and I just could not catch my breath, and I couldn't like find my breath. And I remember my roommate at the time told me that I was having a panic attack. And that was the first time I was like, oh, this isn't how everybody experiences life.
I was crying on the way home and I had to stop because I thought I was going to, die. So I was like, let me see if I can check myself into urgent care. I couldn't make it. I ended up having a panic attack on the side of a street next to scaffolding. And then at that point I was like, I need someone to help me because the anxiety attacks were happening like maybe every 2 weeks.
We also often see a lot of physical symptoms with anxiety. Things like heart pounding, sweating, heart palpitations, headache, dizziness, things of that nature.
I think for me, anxiety could be a very physical thing where it's like I would all of a sudden start sweating a lot, or like my hands are shaking, or my voice is trembling.
My stomach, it feels like it's a knot.
I get this tightness. I feel tight. I feel numb. I feel like my body is getting hot.
Anxiety for me feels like a racing heart, like shortness of breath.
Anxiety can also cause other physical symptoms, such as difficulty sleeping. Sometimes that might be the inability to sleep. Sometimes that might actually be sleeping more often. It can also cause stomach upset. So oftentimes people with anxiety tell me that their tummies just don't feel comfortable a lot of the time.
I'm really big on just like centering myself and grounding myself. So I'll go for a walk in the park and, touch grass, just anything I could do to just bring myself back to my center.
Breathe. That's my number one tip to anybody dealing with anxiety is just take a deep breath and bring yourself back to the present moment. So that way you can actually assess, is something actually wrong or is there something deeper that I need to work out, possibly with therapy or XYZ, whatever is available.
Something that's been really helpful is deep breathing, learning how to connect to my whole body when I'm breathing.
People with anxiety disorders have a really hard time dealing with uncertainty. They just want to know what's going to happen, when it's going to happen, and how it's going to happen. But the reality is that life is full of uncertainty. And so trying to avoid uncertainty or control it too much can only make anxiety worse. And so I often tell my patients, try to embrace anxiety. And I teach them 2 different skills to do so. The first is mindfulness, because mindfulness brings you to the present moment. It makes you aware of what's happening in the here and now. And the here and now can be really unpredictable. And so if you can face the present moment, then you are better able to face anxiety.
I think it was a really long process of learning to live in a way that felt good to me and in a way that was, I don't know, I think it's difficult to find the balance between practicing awareness of something in your life and wanting to deny it or wanting it to be different. And I think trying to find that balance in accepting that I have anxiety and also managing my anxiety symptoms definitely took some time.
Radical acceptance is a technique from dialectical behavior therapy. And it's all about embracing reality as much as possible, really loving reality. And that reality can also be unpredictable. But we have a saying in DBT, it is what it is and everything is as it should be, which helps us embrace that anxiety, and that can help us manage our anxiety.
Yeah, some of the tools that I use to navigate my anxiety include meditation, definitely music therapy and listening to calming and relaxing music, crafts, doing things with my hands, doing things that help me practice presence and openness, and also utilizing the help that I have around me in the community that I've built for myself.
Another thing for me is like meditation and just like mindfulness practices. So I start every day with a gratitude list and I write things that I'm grateful for. And for me, like living in a place of gratitude, and it takes me outside of myself.
My therapist says something to me that's really helpful. He says, imagine as if with your inhale, you're dropping a bucket down into a well and you're gathering as much water and you're going as deep as possible. And that exhale is bringing that water back up and into your body to refresh you. And I think that visual has really helped me.
There are essentially 3 different types of interventions for anxiety. The first is good self-care and lifestyle changes. And so I often tell people, in order to manage your anxiety, you have to have good baseline self-care. And that means things like eating a balanced diet, exercising, engaging in stress management techniques like mindfulness and meditation, making sure that you avoid certain substances that can make anxiety worse, like caffeine, for example. I also advise patients try therapy. Cognitive behavioral therapy has worked wonders for people with anxiety. Studies show that up to 75% of patients that engage in cognitive behavioral therapy feel better as a result. And then there's always medications. If you are experiencing anxiety that feels out of control, then talk to your primary care physician or a medical provider about medication options.
It's really important for me to have a toolkit. And part of that toolkit is my medication.
I was hesitant to try medication because I thought maybe I'll feel weird, I'll be groggy. Like, just try it as soon as you can. I would say like the impact has been like incredible for me. It's really just been a night and day experience in terms of like the value I'm delivering at work, like the friendships that I have. Everything just feels like calmer, more restful, just easier. And people have commented on it, like not knowing that I'm, taking anything, just that I've, been really crushing it at work or, really seem like I'm being myself.
There are different medication options for anxiety. You may have heard of things such as selective serotonin reuptake inhibitors, or SSRIs. These are things like Zoloft and Lexapro. You may also have heard of things such as selective norepinephrine reuptake inhibitors, SNRIs. These are things like Cymbalta. Both medications can be helpful in treating long-term anxiety. There are also medications like propranolol that can be used as a medication for anxiety, although it's typically used as a medication for certain heart conditions. There's also a class of medications known as benzodiazepines, things like Xanax. Now, these are medications that are not recommended for daily usage because they can be quite addictive, but they can be used occasionally for in-the-moment intense anxiety. Remember that there's everyday normal anxiety and anxiety disorders. It's normal to feel anxious or stressed during a particularly stressful situation. It's not necessarily a reason or cause for concern. But if you're experiencing persistent anxiety or worry and feel like you need help, certainly speak to a mental health professional or your medical provider for treatment options.
What I would say to people suffering with or living with anxiety is that take it kind of one day at a time. Like, this day is not going to be every day. Yes, there's going to be some highs. Yes, there's going to be some lows. At the end of the day, if you get your support system, if you have the stuff that helps you when you have triggers, then you can make it through.